Good day, everyone. I am Hannah Angela Grace Neri, and I will be presenting on behalf of our group about one specific developmental stage of the learner, and that is the middle aged adulthood. For the sequence of presentation, we will first talk about the general description of the middle aged adulthood stage, then proceed to its physical, cognitive, and psychosocial development, the teaching strategies, and lastly, the nursing interventions applicable to it. Now, let us start with the general description. From the developmental perspective, middle adulthood, or also known as midlife, refers to the period of the lifespan between young adulthood and old age. This period lasts from 20 to 40 years, depending on how these ages, and tasks are culturally defined. The most common definition by chronological age for middle adulthood is from 40 to 65 years old, but there can be a range of up to 10 years, which are ages 30 to 75 on either side of these parameters. Since middle-aged Americans make up about one-fourth of the population, this current cohort has typically been labeled as the baby boom generation. Research on this period of life is relatively sparse, and many aspects of midlife are still relatively unexplored. In fact, it may be the least studied period of the lifespan. Baby boomers who now make up this cohort are receiving increasingly more attention from developmental psychologists and healthcare providers. This emphasis is occurring not only because they constitute the largest cohort in any current generation, but also because current middle-aged adults are the best educated, most affluent generation in history, and they have the potential to enjoy a healthier life than ever before because of medical discoveries that can stave off the aging process. Middle age has led to increased interest in this developmental stage. As more people live longer, middle age is now coming later in life than ever before. Middle age for many healthy adults is starting later and lasting longer. Although chronological age is one factor, biological, psychological, and social age also must be considered. During middle age, many individuals are highly accomplished in their careers, their sense of who they are is well developed, their children are grown, and they have time to share their talents as well as serve as mentors for others and pursue new or latent interests. This stage is a time for them to reflect on the contributions they have made to family and society, relish in their achievements, and re examine their goals and values. Next, we will discuss the stage's physical, cognitive, and psychosocial development. During this stage of maturation, physiological changes or the physical development begins to take place. Skin and muscle tone decreases, metabolism slows down, body weight tends to increase, endurance and energy levels lessen, hormonal changes bring about a variety of symptoms, and hearing and visual acuities start to diminish. All these physical changes and others affect middle-aged adults' self-image, ability to learn, and motivation for learning about promotion, disease prevention, and maintenance of health. This is according to Crandall et al. In 2012. For many adults, the accumulation of life experiences and their proven record of accomplishments often allow them to come to the teaching learning situation with confidence in their abilities as learners. However, if their past experiences with learning were minimal or not positive, their motivation likely will not be at a high level or not be at a high enough level to easily facilitate learning. Physical changes, especially with respect to hearing and vision, may impede learning as well. This is according to Santrocht in 2017. The ability to learn from a cognitive standpoint remains at a steady state for middle-aged adults as they continue in what Piaget, in 1951, 1952, and 1976, labeled the formal operation stage of cognitive development. He maintained that cognitive development stopped with this fourth stage, which is the ability to perform abstract thinking. However, over the years of critics of Piaget's theory have begun to assert the existence of post-formal operations. That is, adult thought processes go beyond logical problem solving to include what is known as dialectical thinking. According to Crandall in the same year, this type of thinking is defined as the ability to search for complex and changing understandings to find a variety of solutions to any given situation or problem. In layman's term, middle-aged adults see the bigger picture. Erikson in 1963 labels this psychosocial stage of adulthood as generativity versus self-absorption and stagnation. Midlife marks a point at which adults realize that half of their potential life has been spent. This realization may cause them to question their level of achievement and success. Middle-aged adults, in fact, may choose to modify aspects of their lives that they perceive as unsatisfactory or adopt a new lifestyle as a solution to dissatisfaction, developing concern for the lives of their grown children, recognizing the physical changes in themselves, dealing with the new role of being a grandparent, and taking responsibility for their own parents whose health may be failing are all factors that may cause adults in this cohort to become aware of their own mortality. During this time, middle-aged adults may either feel greater motivation to follow health recommendations more closely or the opposite, which is to deny illness and abandon healthy practices altogether. The later years of middle adulthood are the phase in which productivity and contributions to society are valued. They offer an opportunity to feel a real sense of accomplishment from having cared for others, children, spouse, friends, parents, and colleagues for whom adults have served as mentors. During this time, individuals often become oriented away from self and family and toward the larger community. New social interests and leisure activities are pursued as they find more free time from family responsibilities and career demands. As they move toward their retirement years, individuals begin to plan for what they want to do after culminating their career. This transition sparks their interest in learning about financial planning, alternative lifestyles, and ways to remain healthy as they approach the later years. Depending on individual situations, middle-aged adults may be facing either a more relaxed lifestyle or an increase in stress levels because of midlife crisis issues such as menopause, obvious physical changes in their bodies, responsibility for their own parents' declining health status, or concern about how finite their life really is. They may have regrets and feel that they did not achieve the goals or live up to the values they had set for themselves in the young adulthood or the expectations others had them as young adults. Teaching strategies for learning are similar in type to teaching methods and instrumental tools used for the young adult learner, but the content is different to coincide with the concerns and problems specific to this group of learners. According to Santrock in 2017, this cites that research indicating that this stage in life is not so much seen as a crisis, but rather as a period of midlife consciousness. When teaching members of this age group, the nurse must be aware of their potential sources of stress, the health risk factors associated with this stage of life, and concerns typical of midlife. Misconceptions regarding the physical changes, such as menopause, are common. Stress may interfere with middle aged adults' ability to learn or may be a motivational force for learning. Those who have lived healthy and productive lives are often motivated to contact health professionals to ensure the maintenance of their healthy status. Such contacts represent an opportune time for the nurse educator to reach out to assist these middle aged adults in coping with stress and maintaining optimal health status. Many need and want information related to chronic illnesses that can arise at this phase of life. Adult learners need to be reassured or complimented on their learning competencies. Reinforcement for learning is internalized and serves to reward them for their efforts. Now, let us resume to the nursing interventions. First, let us define what is or what are nursing interventions. So, these are activities or actions that a nurse performs to achieve client goals. Interventions then chosen should focus on eliminating or reducing the etiology of the nursing diagnosis. Work and parenthood occupy the majority of middle aged persons' time and success, and performance are judged in terms of professional successes and family life. Major health problems that may arise at these stages are diabetes, accidents or injuries, heart diseases, stroke, hypertension, alcoholism, degenerative joint disease, gout, gallbladder disease, varicose veins, obesity, visual changes, reproductive or menopausal problems, or and anxiety or stress. Many of these diseases are preventable wholly or in part through behavior changes. Middle-aged adults can influence their own health as well as their children's through healthier lifestyles. Depending on the individual, middle-aged adults endure varying degrees of aging changes. These adjustments can be highly distressing for some people. So for these reasons, the following interventions must be done to detect possible risks: acceptance of aging, nutrition, exercise and weight control, encouraging regular medical checkup, teaching self-breast examination to females and self-testicular examination to males, assess middle-aged female patients for menopausal status and distress associated with menopause. So be prepared to offer credible sources related to symptom relief and hormone replacement therapy, achieving financial and emotional security, and preparing for retirement. Middle-aged persons are in the so-called sandwich generation. That means they are sandwiched between responsibilities and concerns related to their children and also to their aging parents. Substance abuse prevention. So middle adulthood is also the time when a lifelong accumulation of unhealthy lifestyle practices, such as smoking, sedentary habits, inadequate nutrition, and overuse of alcohol begins to exert adverse effects. Stress management and recommendations for health screening, like cholesterol screening, prostate examination, mammogram, and Papa Nicolau or PAP test. And here are our references for this presentation. And thank you for listening. I hope you have learned a thing or two from our presentation about the middle-aged adulthood stage of the learner.